If there is low blood pressure, generally, I've talked about factors or situations that could lead to reduced volume of blood in the body when the person is bleeding, whether the bleeding is outside or bleeding inside. The fact is, when there is reduction in the volume of blood that circulates around the body, when there is anemia, the kidneys are affected acutely, and this, if not well managed, could lead to a major problem of the kidneys. If there is dehydration, even though the blood is not short, but the fluid volume in the body is low, such that the person is dry, the person is dehydrated. Blood is carried by fluids. Blood is in fluids. The blood cells are in fluids also. So it's not only in the bloodstream that you have the fluids in the body. Other compartments in the body where we have fluids, the fluids, are siphoned from all of those areas. When there is low level of fluids in the body, generally the person is dehydrated. If someone is dehydrated to the extent that it reduces the volume of blood that goes into the kidney for the kidneys to filter them and take out urine while the blood is sent back into the body for circulation, there may be a problem with the kidneys. If there are kidney stones, usually when we say kidney stones, something that can come to mind is, are there stones in the kidneys? The stones, yes, there are stones in the kidneys, but they are not the okuta, they are not the normal stones that we usually see around, but they are also, they are substances that have been formed, they have solidified, they are now like stones. They feel, if you touch them, they will feel like stones. If you touch, they may not be as hard as stones. In some instances, they may also be very hard, okay? What brings about this is there are some substances in the body that crystallize, eventually form these stones, and they settle in the kidneys. Okay, so this can also happen. If this happens, it can cause acute kidney injury, because these stones eventually they will block the passage of the of urine in the kidneys. The passage where blood flows into the kidneys, the vessels in the kidneys, and also the passage that the kidney uses to bring urine outside. So from the kidneys, outside the kidneys to the bladder, that is the movement of urine. If there are stones, these stones can block the flow of urine. And when they block the flow of urine, the person is not able to pass urine. Urine accumulates in the kidneys, and this results into acute kidney problem. So acute kidney injury is temporary, and it gets better if we're able to treat it. It is important that acute kidney injury is detected on time and treated promptly.